Welcome to Dizzy Therapy. I'm Anthony Veglia, but a lot of patients call me Doc. I'm a doctor of physical therapy who specializes in vestibular rehabilitation, which means that I treat patients with dizziness, imbalance, and vertigo 40 hours every week. Let's talk. Let's talk about benign paroxysmal positional vertigo, or BPPV. This is the single most common cause of vertigo, but that does not mean that it's an easy thing to tolerate when you're dealing with it. This is Earl the Ear. He's a right ear, by the way, and we're going to show you what's going on. Now, when I'm looking straight ahead, my right ear is angled about here. My big floppy outer ear is out here, the long ear canal, an eardrum, which vibrates with sound, to hit some bones, which vibrates the cochlea. And this snail shell is where we actually hear things, and all that hearing information gets carried down this big nerve off to the brain. But you might notice, that's only half an ear. What about this other half? So this other half of Earl, this crazy maze here, is totally separate from your sense of hearing. This is my area, the vestibular system. This is where our balance awareness and orientation takes place 24 hours a day. These tubes here are full of fluid very similar to ocean water, and it moves whenever you do. I always think of a hula hoop full of water. If you were to turn, well, that water would move too. At each of these three dead ends, there's a little flap that acts as a sensor. Whenever you move, you can tell what direction and how much you've moved, and all that information can get sent down these nerves to the brain as well. Now, deep in this area, it's not really shown, it's inside of Earl, there's a bunch of crystals that make a bed and a wall. And what they do is, if you imagine a buoy in the ocean, it's got a long rope to the bottom. If you saw it moving one way or another, you would know which way the water is moving. And these crystals, that's their job too. If you hit the brakes in the car, or the plane takes off, or you stand up, you can feel momentum forward, backward, even sensing gravity with the wall of crystals. So, all of that information for your balance, for your orientation, gets sent down the vestibular nerve. All of the hearing information goes down the cochlear nerve, and then it combines into the vestibulocochlear nerve. Now with BPPV, the crystals are everything. The sheet of crystals in there, it's a lot like your skin. You make a layer, and then a new bottom layer, and the top layer flakes off, and a new bottom layer, and the top layer flakes off. But unlike skin, which can just flake away and make dust, where are these crystals going to go? This is inside your skull after all. Well, vitamin D3 plays an important role in holding those crystals down, or else they all might break off a little too early. Then they won't all dissolve like they're supposed to. If you have enough of these loose, undissolved crystals, you lay down and they might just wander into one of these tubes. Now, the sensor, which normally just feels the gentle brush of water, gets hit with a rock, or just pushes way more water than normal, and the sensor triggers, so your brain interprets that you're turning, and still turning, and still turning, and still turning. That spinning sensation, that's what we call vertigo. So, what are we going to do about it? Actually, it's pretty simple. Now, you've met Earl. This is Erica. She's also a right ear. We need to get her crystals out of these tubes and let them dissolve like normal. And it's a lot like getting sand out of your shoe. I can't just shake the shoe and expect all the sand to get out. I have to move the whole thing in just such a way to get all of the debris, sand, crystals out of the single exit back where it should be. Then you can lay down, bend over, no more vertigo. It's done. But to get the crystals out, you have to move the crystals, which means you're going to have to go through some spinning to get rid of the spinning. That being said, there are definitely ways to make treatment much more tolerable. Personally and professionally, I strongly do recommend that you do not perform these maneuvers at home without a professional diagnosis and potentially them treating it first for a few reasons. Number one, there are 6 canals total, 3 on each ear, and each of them gets their own unique maneuvers. Number 2, to be successful at these maneuvers, you need to accurately orient your head relative to gravity, sometimes a little bit past neutral, while you're experiencing vertigo. Or else you'll move crystals, but they'll just go right back, so you trigger vertigo without improvement. Or, though it's not super common, you may actually get them to fall into another tube. So now 2 tubes have crystals, and the problem's even worse. Number 3, vertigo is only a symptom, but there's a lot of different causes, not just crystals. The maneuvers are the gold standard for the crystals, but it's not going to treat other diagnoses. So, first things first, get a proper diagnosis and have the professionals take care of it. That's your ENTs, your physical therapists. Find a vestibular provider, someone who treats this often. Have them take care of it, and don't worry about it after that. From my personal practice, I would say roughly 90% of the patients I see with BPPV are totally clear of vertigo within 1 visit, with 2 to 3 maneuvers each to get every bit of sand out of that shoe. The first round's the most intense, then a lot less, and then you repeat till nothing happens. Occasionally, someone does have crystals in multiple canals, maybe one canal on each side, or if there's another diagnosis at the same time, or for some patients who just may be a little more sensitive to nausea, you may need to have a second visit or 2 to really make sure that everything's clear. Once it's definitely clear though, you can go back to normal life basically right away. You might feel a little off for a day, like if you went on a roller coaster ride, but you should be able to lay down to sleep, tie your shoes, back to normal. If there's no crystals, there's nothing triggering the vertigo. So, I always tell people though, if there's still a little bit of spinning or dizziness while lying down, there might be a few rocks left in there, you come right back in. The good news, there are 2 big things that you can do to help prevent this from ever happening again. Number 1, vitamin D3. This is the big one. If you're deficient, the chances of those crystals getting loose and getting stuck in the tube again goes way up. While you're at the doctor, the ENT, you can have your blood tested, see if you have low vitamin D. Number 2, don't hit your head. That can certainly knock crystals loose, and often if it's from a head impact, it actually takes more maneuvers to get it done, and it tends to scatter into more than one. A last note about BPPV. Some patients are really scared to get into certain positions because they think it'll trigger again. They'll avoid yoga or tennis or golf or all these other recreational things. The thing is, most BPPV is just random. Vitamin D3 deficiency is certainly an impact, but so is age, osteoporosis, diabetes, hyperlipidemia has a big impact, whether or not you have a history of migraines. There's a lot of factors, and maybe you have none of those, but you still got BPPV. That's actually not terribly uncommon either. But going into positions like laying flat or downward dog in yoga, it won't cause BPPV, and avoiding them won't prevent it. Simply, it happens, get the treatment to get it better, and it is a benign paroxysmal positional vertigo. The benign part means it's not damaging anything. The ear is healthy and back to normal once it's out. So, don't be afraid to move and stay active. To summarize, the vestibular system in your inner ears is where most of your balance and orientation comes from. Calcium carbonate crystals are inside your inner ear, but they can get loose and lead to positional vertigo. Visit your ENT or vestibular physical therapist to perform maneuvers to relocate those crystals back to where they should be to dissolve. Once it's gone, it's gone. You can bend over, lay down, etc. There's nothing triggering the vertigo. There's nothing to trigger vertigo. To keep it away, vitamin D3, don't hit your head. And that's it for benign paroxysmal positional vertigo from a vestibular specialist. Thank you so very much for watching. Always stay curious about these incredible bodies that God has designed for us so well. Leave a question in the comments below because I would love to know what you all want to learn. Subscribe to Dizzy Therapy for more videos in the future. And remember, dizziness, imbalance, and vertigo are never normal. So visit your ENT and vestibular physical therapist as soon as possible so you can get back to moving freely. Have a great rest of your day and may God bless you with stability throughout your dizzy therapy.